we hope that we can reassure people, at least as far as that we're doing everything we can to find out what's going on. So what is PFOS? I'm not even going to try and say it. It was the key ingredient in Scotchgard. 3M pushed it out all over the place. It was in firefighting foam. It was the lining of pizza boxes so that your tomato sauce didn't soak in. It was Scotchgard in carpets. It was the water shedding agent on clothes. It's used in metal coating processes, and it was a wonder substance. And it has now been withdrawn because it is a very persistent chemical, and it's even been found in the Antarctic. So that's what we're dealing with. It's also used in commercial aviation in Skydrol, which is apparently an aviation hydraulic fluid. What have we found? Well, middle of December we were asked to look at a borehole. One of the residents in St. Peter's thought their water looked a little strange. So we sampled. We can't test for it here. There's only a couple of labs in the UK that test for it. We sent that back, and it came back and it had PFOS in it. Very small trace amounts, and in an area that we wouldn't have expected to find it. It was nowhere near the end of the airport where we had the fire training ground incident when I was probably still at school. So what have we found? Well, in terms of, what happened next? We then went out and said, this is strange, we need to sample some more. Is it a one-off or other boreholes? So we widened the circle, and we went out and sampled some more, and we found similarly very low amounts in those as well. It takes about 2 weeks from sampling to courier it to the UK for them to test it and then to get the results back. Any results we've had back have been shared with the person that uses the borehole. As far as we're aware, we hope we've done that, and we will continue to do that. It's important that you know what we're finding. We've got, as a department, we've got nothing to hide here. We need to work with you. So the two things that we've been testing for are PFOS and a metabolite, PFOA, which is what it breaks down to and sometimes what it comes with. So the highest that we've found so far is 0.0590 micrograms per litre in terms of PFOS. The guideline at present is 1 microgram, so it's significantly less. In terms of PFOA, it's 0.0235, and that limit is 5. So again, it's considerably less. It's still far more than we'd like those to be zeros. We don't want to be finding it in there. We also tested some surface water to see if we could find out where it was coming from, and we were somewhat surprised to find the surface water levels were coming in actually higher than the borehole, which is very strange. You'd expect the surface waters to be clearer generally, and it to be in the groundwater. So there is no guideline for surface water. So again, we got up to 1.24 and 0.454. So that's what we've found so far. And in an area away from the one that was traditionally known as the plume area, which Tim will talk about in a minute. So this is a new area. Where have we found it? That's for Tim.
Thank you, Stuart. Yeah, I'm Tim Dufer. I head up environmental protection, so we work with Stuart's team. Stuart, as he explained, deals with the health aspects of polluted water, and that side we deal with the investigation of finding out pollution and investigating pollution events. Is that quite? Just to get your bearings, I'm going to talk to you a little bit about the sampling program we've done, which Stuart's touched on, and what we want to do in the future. As Andy mentioned, it's evidence-based, it's absolutely precautionary, no assumptions whatsoever. We've already seen that if we assume things, then it will lead us on the wrong path. Just so we get our bearings, so we've got the main airport, the main runway. We've got Jubilee Hill coming down. Then we've got Leeds here, Leeds Village. Okay, so the borehole that Stuart mentioned that the lady had a concern, and we went to sample, was in that collection there of dwellings. That was the first sample we took. What you see here on the map, all the red dots, I think you probably know you've been asked to register your boreholes. It's a very useful map. So the red dots are boreholes in use. The purple ones are abstraction licenses, so irrigation for farming. Yellow are disused. And the hexagonal ones are wells. So we've got a pretty good idea where the boreholes are around this area. A message really, if you're here and you haven't registered your borehole and it's not on there, please do so, because it means we know where you are and we know where your borehole is. So the first look was on that borehole there. That, as Stuart mentioned, produced a positive result, albeit at a very low level. We then went out and we sampled this area here. That was the next phase, and the next phase after that was sampling wider and up into the village and along the stream. Stuart mentioned surface waters, so the stream that runs down Jubilee Hill really. The surprise there generally was we were finding it on the other side of the airport, so you've got the valley in between. Basically groundwater comes down this way and we were finding it up gradient. So that's, don't assume anything. That was a generally, the lowest levels were further away at this point, and the highest levels were towards the airport side. In the stream, the highest levels were around here, and then lower and lower. Again, very, very low levels, but it's there. And our job is to find out where else it is. So the next phase, you can see all these boreholes. At the moment, we're going through all of these. There's about 300 we're going through and selecting out other boreholes to sample from the area. We're also selecting out all the drainage coming from the airport. So there's drainage up here, there's drainage down here. We'll be sampling water going into the reservoir and sampling down this way. What we also want to do is sample island-wide, because the levels we're seeing could be background levels. As Stuart said, it was used in many, many products, which we all used. So what are our background levels around the island? That's an interesting question, but it's one that's going to be bottomed out. So the whole idea of something is to do it once, absolutely precautionary approach, comprehensive sampling, and then each stage of the sample will feed into the next. So that's where we are at the moment. The groundwater, boreholes and wells, surface waters, and then that will inform the next stage.
So you will probably also remember there's a historical pollution down towards St. Juan's Bay, which we've all know as the plume. It's sensible, if we're doing this sort of research, also to make sure that we are confident that we know where that plume is. The best way of doing that is to go down there and test it. So we will do that. We've already had tests from some of the bodies of water down there, but rather than using theory and using other ideas of where it might be, we're going to go and test these. So we've ordered another 100 bottles, and we'll probably need another 100 after that in order to get a really good idea of what's going on. Tim mentioned some of these others. We need to control. We need to make sure that we're not finding a background level. We actually hope that we're not finding a background level. We'd prefer not for it not to be ubiquitous. Certainly in certain parts of the world it is. And they've found it in Antarctica, which is not really good for the planet. So we'll talk about international standards, and these are a movable feast, and they will move. I've been talking to John Fowle, who is employed by WHO and by EU to set these standards, and he's fairly sure that they're going to come down significantly. So WHO's suggestions, it comes down PFOS to 0.4 micrograms per litre. Not surprisingly, as it's the same guy, the EU are going to do that. Now, WHO haven't confirmed those. the EU, the WHO has guide values, because if they had targets, many of their members would miss, particularly in the third world countries, where it's less easy to control pollution at the moment. The EU has standards which have to be met. And again, it's not updated, but there was a draft out at September last year, I believe. And these are the suggestions they're coming to. 0.4 micrograms per litre and 4. And at the moment, these are the highest that we've found. So again, it's orders of magnitude less. Even though the standard is coming down tenfold, we've still really got another tenfold till we get down to those. At the moment, the UK Drinking Water Inspectorate, which is what we follow, are on 1. So it's quite a reduction, and on 5. So that's where it's going. The latest suggestion we've had from Denmark is it goes to 0.1 and less than 3. So there will no doubt be a bit of a debate in the EU about which one of those they follow. We will be led by their experts who know far more than we do. The other thing we should say is that Jersey Water carry out their own sampling as well to make sure they know what's going on, and they share their results with us because that informs our overall picture of what's happening. They are particularly interested in the historic pollution down towards St. One's, because they had some boreholes there that they would love to be able to use, obviously, and obviously what's going into the streams that will end up in the reservoirs. So my guess is we're going to end up somewhere between 3 and 4 for PFOA, and 0.4 probably is where we'll end. I doubt it'll go there, but if it is, we would clearly use that in our regulation. And again, we're still significantly below that. So, advice on boreholes. This was sent out in the end of 2015, I believe, although some people say they never got it. That may be the case. There are copies here this evening. That is being revised and will be reissued to everybody on a registered borehole. I know from my own experience that some things come through the letterbox and don't get read. I'm not saying that's the case. You may not have received it, but this is being revised and we will send it out again. And there are copies here today, should you want them. The nice thing about Jersey Water is they've got many reservoirs and they've got a desalination plant. So they can blend to reduce pollution should they find it, and they can usually blend it so it's no longer detectable should they wish to do that. You can't do that with a borehole. As with food, which we regulate, as with everything else, we need to be sure what we're putting in our bodies. There are all sorts of things might be in the borehole. What we want to say is if you're using a borehole and you're expecting, best not to drink the water. If you're a nursing mother, best not to drink the water. And if you've got kiddies under 3 who love drinking water, best not to use the borehole unless you know what's in it. If you get it tested regularly, that's fine. But it can vary. It could be fine yesterday, in 6 months' time, it might not be. So adults, it shouldn't be the same sort of problem. We can give advice about having it sampled. We can point you in the right direction for having it sampled and for the things you should sample it for. So perhaps whilst we're on that, something that Alex's team were already on with was something that one of our new mums on the team was doing before she went on maternity leave, which is revising the advice that our nurses and midwives and hospital departments give to mums and nursing mothers, because the one that goes out at the moment is very old and is probably not as accurate as it should be, and I believe that's with your team now. And again, as soon as that's available, that will be going out through family nursing, through midwives and everything else. And really, it pretty much says this, but it also gives further advice on bottled water. So if you're using bottled water for kiddies, make sure it's not high sodium, and that is on the label. We need to make sure that we take care of little ones, because the little ones' bodies are growing quickly and they tend to absorb things rather more quickly than old decrepit ones like mine would. So what happens next? Tim's touched on it a little bit. Further testing of boreholes and surface waters, and comprehensive testing. We're talking about I would guess another 200 and 250 plus samples, because we need to know what's there. We don't need to guess what's there, we don't need to have theories, we need to go out and measure it and find if it's there or not. It'd be great if we could rule out great patches of the island, but we need to do that. We need to find out what's there. So we're going to go right around the airport. For years it's been believed it was only at the end where the fire training ground is. Clearly that's not the case. We've found it elsewhere, so let's go right around the airport and either rule those areas in or rule them out. We'll take control samples well away from the airport to see if the levels we are getting are ubiquitous. We hope they're not, but in certain states, in the United States, if you sample, you'll find PFOS wherever you sample. Around the area originally identified after the incident, so we need to go back and revisit that to make sure the historical data is right, or to prove it wrong, or to prove it's changed. To see if that plume area is right, to see if people are taking water from within the plume and irrigating from outside the plume that might be making other effects. So again, that will be surface water, that will be boreholes, that will be springs, that will be lakes, and we've done some of that already, but we need to do a lot more to get a better picture. The other thing is, as we get results in, that evidence might make us change where we need to go. We can't just blindly say we're going to do this. If the evidence that we're getting, the scientific evidence, suggests we need to do different samples in different places, we will do that. Because what we're trying to find out is what's going on, as opposed to sticking rigidly to something that we think might be going on. Reissue the advice of users, to users of private water supplies, boreholes, we've mentioned that. Revision and reissue of advice to expecting and nursing mothers and parents and guardians of kids under 5. We will do that. We are charged by John Young, Minister for the Environment, that he will have an interim report by the end of April. Bearing in mind it's a 2-week turnaround, there's a lot of really hard work going on there. I don't see my staff a lot, apart from when they go out early in the morning or when they come back muddy in the evening. Having sampled, and it's really important we do that and we get out there and do that. The next session is questions and answers. We might not have an answer, but if we don't, we can say we don't. We got nothing to hide here. We're trying to find out what's going on, and then we can make our report to the Minister. But if we don't, we can say we don't. We got nothing to hide here. We're trying to find out what's going on, and then we can make our report to the Minister.
So we've just got a bit of an open session now, whether anyone wants to ask any questions, and we can, hopefully I'll direct it to either myself or to the right person. We've got a blend of our experts here today. So, yeah, you've got your hand up first.
If you've got PFOS in the borehole,
yeah,
can you treat it at home to remove it?
Do you want me to take that one?
Yeah.
Quite possibly, but it depends on the levels. So one of the boreholes, somebody's got a reverse osmosis unit on it, and there were very small traces before and none after. But what I'm not going to say is rush out and buy that, because that's just working on a very small amount that's reducing. We would need to get manufacturer's guidance on that before you went charging out to do that. But it is possible.
Well,
and
has a reverse osmosis unit
yours
was tested with PFOS in it?
Yours is the one then, is it? Yeah. There was
once it's gone through the RO unit. Yeah.
Nothing before, something before and nothing after?
Well, we've always had that reverse osmosis.
Yep.
So I think they only tested the water.
We've got somebody, well, whether in the room or not, we have one supply where we tested before and after, and it was in before but not after. Okay, well that suggests it will remove it, but we shouldn't be yet going out. We need to wait and see what sort of levels it are. We don't want to recommend anybody putting something in that will only work on trace levels. We need, it needs to be a suitable solution for your situation.
Is reverse osmosis unit the only option?
No, activated carbon filters will take it out. The danger with all those units, of course, is they fail to danger. So a little bit like the UV tubes that you have for getting E. coli out. It might look like the tube's still on, but it might not still be producing ultraviolet. So you need to work with your company that provides all that to make sure that it's working and it's up to date, and not just a quick wipe over with a greasy rag. They need to do a proper job on doing that. But there are systems to take it out. Yes.
I think actually there were 2 boreholes with reverse osmosis 0.00568 going down to less than 0.0009. That's sort of if you want to chat over that result with Stuart's team.
Okay.
You know, let's have a talk about that and see what the figures were.
What's missing for me is how many boreholes you've tested and how many came back positive for PFOS?
Everyone we've tested has come back positive. We've done about 20 so far. There are still, we've sent some more samples off. We might have found one that didn't have any in, but thinking about the results, one or two have come back below level of detection, one for PFOA and one for PFOS, but I think apart from that, all the ones have come back with very low level in, but we haven't, apart from that one, I don't think we've found one that hasn't got it in there.
And were they all within the vicinity of the first house, so region of Rockingham, top of Jubilee Hill?
Yeah, the testing so far has been north of the airport, so can we just get that map back up? The testing's been in this area here, and as Tim said, down along the stream that goes down Jubilee Hill. So it's been in this area here, but we are now looking at something along points of the compass around the
South end of the village as well, I think. Some up there. Yeah. So yes, everything that we've sampled here has had something, we found something.
And you think the source of it was from the crash up here?
Well, one of the jobs we're doing is looking at a lot of historical evidence. We've had a lot of people in the community give us a lot of evidence as well, photographs and things like that they've seen over the years. Clearly there has been some air crashes over the years. Was it Sulaglees? Was it up there somewhere? We've had something down here. So over the years we have had incidences where the fire service at the airport have used stuff. We don't know if it's linked to that, but we're going to have to do some work as to what we're finding.
Yeah, that's probably a source.
And then trying to trace it back to what we think may have caused this. So.
It's probably simplistic to find one source. I think when you think of what's been happening at the airports when they were using it, we had the fire tender turnover with the spillage. We've had one or two smaller incidents. We've had the air crash. It's likely that there are many sources. I think if there was one source, we'd have found it before now. It could even be that it's just the groundwater, the soil itself that is contaminated and heavy rain brings it off. But again, if we need to sample the soil, we'll do that. That sort of sampling will be evidenced by the results we get back. So we need to see what we're getting to direct us with that. I would be astonished if we could just say, oh, it's just that. Life's not ever that simple.
Let's get that lady there.
So I just really want to kind of ask, how will we be informed when we get tested? Because we are literally not even 50 metres away from the house Sulaglees that the plane crashed into, and I have newspaper clippings personally of how the fire service used to empty their tanks and everything on their training ground. We couldn't be any closer, and I have a young baby, and I've raised my concerns by phoning up, and I've just been told we're not in proximity all the time. It doesn't seem to be.
Okay. I think what we're saying is we are testing everywhere, so I think we are saying the historic stuff around the fire training ground was up this end of the airport. So historically there's a lot of focus in this area. But what we're finding now, we've got to focus around the entirety of the airport, so including your area as well.
Yeah, because when I phoned up, they didn't even know our house was there, but it was built in the 1800s, so it's been there for hundreds of years.
The new sampling regime, I think I got from Jodie about 4 o'clock this afternoon, and I'm fairly certain that your house will be on it, because if it's on a registered borehole, it will get sampled, especially if it's so near.
Yeah, we literally couldn't get any closer, and I understand, like, that's the historic zone, but you would have thought, being the house next door to where the plane crashes, it would have been more of a priority to test.
Well, when we did the initial testing, we did a little bit of pepper potting, and what we showed was the entire area, the groundwater's like that. So it doesn't necessarily, I mean, you could be fairly certain if your neighbours have got it, you've got it. It might depend a little bit on the depth, but when we looked at the depth of the borehole, that doesn't seem to make a difference. You will be tested for peace of mind or otherwise. My advice would be with a little one, as it would be for any borehole user, unless you know exactly what's in it, find a low sodium bottled water to make feed from.
Yeah, we are having other tests done through Jersey Water as well, just to find out exactly what is in it. But obviously Jersey Water doing tests for PFOS, so it's more like just to find out exactly what is in our water source.
Yeah.
And we are getting other tests done.
Yeah.
So.
If you need help with those, ring us.
Gentleman at the back of his hand, then there's a lady there just behind you.
I've got a question regarding the accuracy of the sampling.
Yeah.
I know for a fact that we've got a water treatment plant attached to our house, and many of the dwellings around us have the same. Some with reverse osmosis, some with carbon filtering.
Yeah.
And you think that those two forms of treatment will reduce the PFOS. And the samples that I know that have been taken post-treatment, not pre-treatment. So the levels to be found in the actual boreholes themselves are not actually accurately being tested.
That's not actually the case. We've noted where people have treatment because I mean, what's important to me is what you're drinking.
Yeah.
But in terms of what's taking it out, we've got a lot of boreholes without any treatment whatsoever. So that gives us a good picture of the overall groundwater. And the ones that have been taken post-treatment gives us some sort of idea of what the treatment is doing. In terms of the testing, it goes across to the lab that the Environment Agency in the UK uses. There only are 2 or 3, so the tests are fairly accurate.
I'm sure the tests are accurate. It's more the sampling.
Yeah.
If you're sampling from a vast majority of dwellings that are using the water treatment processes that we talked about.
Very few actually have water treatment on. And we've got sufficient numbers that haven't to know that it's in the groundwater.
It's important for us to know both, actually, to answer the question the gentleman said there, if you've got this plant on the end of your borehole, does it help or not? So, we need to get data from both sides, I think. I was going to come to a lady there with your hand up.
Yeah, I'd be interested to know how long the sampling is expected to take. Once you do the maybe 250 across the island, what timeline are we looking at?
Yes, the main job we've got to do, we want to build up a big enough picture as soon as we can so we know what's going on. So as Stuart's outlined, a test, we have to send it out to the lab in the UK, so it's a 2-week turnaround effectively for a test. We want by the end of April for the ministers in the report to the minister to show as much as we've found. I don't think the testing will stop there, and I think we will end up having a programme of monitoring and testing for some time to come. But I think we're doing quite a big flurry of testing to understand what's going on now, but I think we will end up doing some longer term testing as well. I'm not sure if that answers your question.
Yeah, it does.
Yeah.
I think it leads to a second question though. What are you going to do for people in the area that are clearly affected by this in terms of drinking water? We technically don't have any unless we're having bottled water, specifically for young people, young children. We have them, many of our neighbours have young children.
So the immediate thing is if you see results that you're not happy with is to look for bottled sources. That's our advice. We are as part of the work we are also talking and working with Jersey Water in terms of they have a programme of mains extensions across the island. So they have their focus is to extend their water mains to more and more properties. We have about 3,000 or so properties in Jersey without mains water. So Jersey Water would like, over time, to extend their supplies to every property in the island. So we're working with them as well to see where their priority areas should be. So they have a programme for that.
And I take it that the states will actually fund the cost of putting all of us on mains, given the fact that this is not this is an island-wide issue.
So that discussion hasn't been had yet. So there's been some pressure for the states to do that. Historically, when we had the events around the fire training ground, the airport paid with some very, very high results down here, and that meant that there was some government money that was used to extend water mains.
Money. I thought it was the money that came from 3M.
Yeah, so the airport also have ongoing liabilities. So there is some money from 3M. There is some ongoing money that the airport pays for as well. So there will be pressure for public money to be used, I think, for extending the mains.
Do you want to talk about the other group?
Yeah, I can do. So we've got two things working within the States at the moment. So we have a political group, which includes the Deputy and the Constable of St Peter, the Infrastructure Minister, the Health Minister, the Environment Minister. We are likely to now involve our Constable for St Bernards and St Wands, plus the parish deputies around the airport as well. So we have a political board, so that we are briefing them as to what's going on. Secondly, we have a working group of, if you like, our government experts working with Jersey Water to understand what's going on. So that's meeting every 2 weeks, and there's a lot of work that's taking place in between those 2 weeks to understand what is the data showing, what's the evidence showing, and it will lead to a report to the Minister which will open up, and this is what we think we should be doing about it. So in terms of mains extensions and stuff like that, that will have to be covered in that report. We will have to look at that. Clearly the Environment Minister has already said his aspiration is that we extend mains water to everybody in the island. Some people don't want it, some people are pretty clear about that. Some people have the main running past their front door and don't connect. Some people do. So that's going to have to be something for that report, taking it further into April and beyond. Okay, so I've got a couple of, I'm going to come back to you. So this lady and then this gentleman.
So I've got a family member who works for 3M, and he says that there's not much evidence about what the effect is on the body, but he does say that it lodges in fat in the body. Now you're testing this water now, but clearly these problems were a long time ago. You knew there was a big, not you personally, but you knew there was a problem there, and then you knew that the substance had been used nearby, and then nothing's been done. So I brought my children up for 20-something years, drinking that water, thinking it was fine. I would be really interested to know how perhaps the Minister of Health could tell us what, you know, is it in all our bodies? Have I affected my children?
I am going to defer to our health colleagues over here. Susan, would you like to have a view?
Sort of empirically, you know, these substances have been used for a long time and there are potential health effects. There haven't been an awful lot of actual human studies, but there is some guidance out from the Centres for Disease Control in the States, which is saying that there is now some limited evidence that certain things can be affected by long-term exposure. And there's guidance for clinicians as to how to assess people who think they've been exposed. And I think what part of my role in this, apart from being part of the working group and making sure that everything is being done that can be done to protect human health and to sort of be ready to, if the Health Minister asks me for advice, to at least be very well informed to give that. I think I'm also going to be sending the guidance out to doctors in the island so that if people have health concerns that they have the best guidance that there is, which actually was published last month, about the health impacts of PFOS and PFOA. The other thing I would say, just having read this in the last week or so, is that there are 2 cancers that are potentially affected by PFOS, PFOA exposure, and they are kidney cancer and testicular cancer. And we don't have high rates of those cancers in the island. But we do have high rates of smoking-related cancers, which are different. Lung cancers, head and neck cancers. But the ones that seem to be associated with these substances are not at high levels in our population. So that, to me, is a sort of broad brush level of reassurance.
But of the examples where there are evidence of that, maybe we should be looking at a sort of a map like this to see if they are more prevalent in this area. Because that's a real worry. My sons, you know, have the possibility of having that in the future. Yeah. I'd be really interested to know where in Jersey that is happening.
I don't know how easy that would be to do. Look into how we would do that, to see if there are any particular hotspots. But those are both very rare cancers anyway, so given that we're a small population, chances of finding high numbers of rare events that are rare anyway are, but it's worth having a look. It's not impossible.
I'm just going to come to the gentleman with the yellow jacket.
Thank you. I'm going to follow on from that question, actually, Kenny, one of the questions I asked. I think there is a lot more research that's been done on PFOS. Even just looking up PFOS.com, they actually give you a whole list of all the effects or impacts, long-term health impacts that happen Sure it is.
But what's the body that publishes that?
I'll come back to you on that one. I'll have to go back
Is it a
into
government
it, but
body?
it is from the States, yes. One other thing is that they do recommend a lot more actual testing on people rather than testing on boreholes and things, because then you can actually pick up the contamination in the people and then work out from there where the contamination comes. So has that been done in tests
Well,
on people?
the major studies in the States, the control the people that use as controls also had PFOS in them. What I have been doing on behalf of Medical Officer of Health is looking for a lab that can actually do those blood tests, because that's not easy to find either. And we've got the manager of the PATH lab looking across the UK and Europe to find somewhere to do those tests. It's not a question of not wanting to do them, it's a question to find somebody to do them and the methodology behind them. Certainly in the States, it wasn't just a pinprick, it was a pint of blood and then plasma and then having the test done. So we need to find the methodology, we need to find a lab that's capable of doing it, and then we need people's medical practitioners to say they believe it is a sensible way to go.
Can I just comment on that? Because actually the US CDC guidance is saying that it's actually pointless to measure the levels because it's ubiquitous. When you start with the health problem and then you have a clinical assessment along with an assessment of the levels if the people have the particular medical problems that may potentially be linked to it. So it actually sort of broad brush testing a large group of people is going to find a lot of people who've got levels of it, because that's what you typically test a population.
But the medical problems the medical problems you were saying aren't completely established yet, so is that what?
Well, no, there is a list in this guidance for clinicians. Things like...
I think what I say is some of this is a very new developing area in terms of we are all, if I'm being honest, exposed to a lot of things in our environment. So trying to, I guess from a health perspective, trying to pinpoint down any conditions to a specific cause is pretty difficult in some regards. But we're going to need to look, as Stuart said, in terms of what some of our colleagues in health are saying in terms of what other tests we could do. So,
Can I just add to it?
yeah.
We haven't spoken about the main plume area, and I think that might reassure you a little bit. The main plume area's got levels of 30, average of 30, up to about 90 micrograms per litre. We're looking at 0.005, so they're way above, and you're 100 times below the drinking water, the average of what we've sampled so far, 100 times below that drinking water limit that Stuart referred to. So that's the sort of scale we're on. There's evidence in the UK that ubiquitous level of PFOS in the environment are those sorts of levels. So, you know, that may reassure you about the...
Gentleman there has only sat up for a while.
It's all right, no problem. I've got a couple of questions, that's okay. I'll hopefully be fairly fast. The first one is, I'm misunderstanding this evening. I'm in one of the properties in that particular area.
Yeah.
The last communication we received from the government was do not drink the water out of the borehole, based on the testing that has happened. Is the government saying tonight that it is absolutely safe to drink from our borehole?
I would never say a borehole was absolutely safe unless I'd seen what was in it. It's not just PFOS, is it, that might be in there? There are lots of other things. My department hasn't sent anything out saying don't drink the water.
Well, I'm not sure it's don't drink the water, but it's advised you to take care of the borehole.
Yeah.
Yeah.
There is elements of doubt in the communication. That's my point.
I think I've got a borehole as well, and it is, you never generally know what's in it from one day to the next. You hope it's fine, you get it tested, but once the test has been done, a week later it could be different. 2 weeks later it could be different. So I think, you know, all I'm going to answer your question in terms of how do I apply that to myself, and think, well, you have to take a bit of a risk-based approach yourself. Think, how often do I get my water tested? How do I know what's in there? I'm confident about what it looks like, smells like, tastes like.
Okay, which sort of leads me on to my second question, which is a bit of a wider question.
Yeah.
In that you made reference to the plume, and the plume occurred many years ago.
Yeah, that's in this, effectively it's in this area.
It's a similar vicinity, okay? Since those events, and I've seen a report that indicates that there were health defects associated possibly to the plume, how often has the state tested the area for PFOS since the events in the plume to date?
It's tested fairly regularly. It's at least twice a year those places have been tested. If it's the same report I've seen, there's no cause and effect in there. It lists a lot of people that have been ill, and some doctors saying that might have been the cause. I can't say it wasn't the cause, but neither can anybody say it